All right, good afternoon, everyone, and thanks for joining our webinar today. We're going to wait just a minute or so to get started to give everyone that hasn't arrived yet the chance to jump online with us. Okay, let's get started. Hello, everyone, and welcome. My name is Julie Tremblay, and I am the Marketing and Communications Coordinator at Testo North America. We have a great session for you today on validating and controlling IAQ in educational facilities during a health crisis. And so before we begin, we'd just like to mention that today, one of our subject matter experts in the fields of indoor air quality and instrumentation will be discussing the impact of the COVID-19 pandemic on the education industry and ways to mitigate the spread by monitoring and recording carbon dioxide. As the COVID-19 landscape is evolving rapidly, the information discussed in this webinar should be considered general insights and opinions from an industry thought leader. These opinions do not represent the official position of any organization represented in this session and may not apply to all circumstances. Prior to incorporating any recommendations discussed during this webinar, all attendees and participants should first check with the appropriate health departments and/or corporate quality groups for further guidance. Now, to kick things off, let's go through a few logistical matters. Our session today will run about an hour. We will have all attendees muted, but we encourage you to submit questions in the questions panel to be answered at the end. And we are recording the session today, and we'll send a recorded version of the webinar to you for reference after via email. And now I'll go through a brief introduction to Testo and our products and services. So for over 60 years, Testo has stood for innovative measuring solutions. Testo helps over 650,000 customers worldwide save time and resources, protect the environment, ensure quality, meet regulatory expectations, and increase the value of their goods and services. Testo is a major supplier of monitoring instruments for markets as diverse as chemical, food service and production, pharmaceutical and biotechnology, as well as commercial and residential HVAC suppliers. And our speaker today is Aaron Longecker. Aaron is the product manager for instrumentation at Testo North America. He has over 10 years of mechanical contracting experience, in addition to 10 years of pharmaceutical supply chain project management. Aaron manages Testo's diverse instrumentation profile in HVAC, combustion, electrical, indoor air quality, thermal imaging, food, and pharmaceuticals. Aaron is a graduate from Albright College with a Bachelor of Science in Business Marketing and a Master's in Business from the University of Phoenix. He currently resides in the Westchester, Pennsylvania area and enjoys camping outdoors, hiking, and various adventure sports, as well as spending time with his 2 children. And so with that, I am going to turn things over to Aaron to dive in.
All right, well, thank you, Julie. Appreciate that. And hello, everyone. So today we're going to talk about the validating the indoor air quality of the education places, especially with schools and any other learning centers that are in that whether it's your students, whether it's your children, are all taking place in, or even yourselves in different matters of where large groups of people will gather into an indoor space and be able to carry out life as we used to know it from that. But for today, what I first want to start out is just a quick little overview of Testo. So Julie, thank you for kicking us off there. The one thing that wanted to make the claim is here from we are one of the world market leaders in measurement technology, and what I mean by world leader in measurement technology is we measure a lot of different things, whether it's we use infrared for measuring, there's nanoparticle measurings, we measure CO2, CO, NOx, nitrous oxide, hydrocarbon sulfides. We're measuring pressures and velocities, even measuring a little bit of light as well too, because light is a big thing with UV, air pressures, all different things that we measure. And all these measuring devices are in various industries. Especially, we want to make sure that we have that capability to, bring products to the market. And the nice thing is too, with these products, we also calibrate our own things. So, especially with indoor air quality, NIST certifications are very important. That's a yearly thing that's done. So a lot of our instruments can come with NIST certifications. We'll calibrate them. We also service them. So we're kind of your all-in-one shop when it comes to any kind of measuring device, and as well as calibration and service, because make sure you have calibration is a very big piece to these instruments, because again, they do come out of calibration every once in a while. They need to be certified, just like our ISO standards and whatnot. So we're going to go ahead and jump right in, get this really started here. So from a whole, as of 2020, with right in the March timeframe, obviously we're very well aware when COVID became a thing here in the U.S. The world shut down for a little bit of time. The one thing that was going on, especially with the governments of the world, the different groups like the CDC, the NIH, the healthcare institutes, and also industry was getting involved as well too. And exactly what and how can we take care of this pandemic to try to keep life going on as normal. So those that are familiar with ASHRAE, that's kind of the biggest topic that we're going to have here. ASHRAE developed the Epidemic Task Force. The Epidemic Task Force was formed with the constant changes within the science, within the CDC's recommendations, and also taking a look at what information was available and exactly, okay, how can we handle this virus? How can we take care of this? And how can we make sure that we can get everyone back into buildings, be safe, that we can slow the spread of what needs to go on here? So the Epidemic Task Force was formed specifically around schools and universities. There are other epidemic task force for commercial buildings. There's other aspects as well too that ASHRAE took a look at. And if we're fairly familiar with ASHRAE, ASHRAE is an organization where it's more along the lines of air handling and engineers that come together and set specific recommendations on how these units, these indoor air quality units, HVAC systems have to run in order to make sure you are comfortable, make sure that any particulates that are in the air are filtered out and removed, and making sure that cognitively that everyone is sound within a confined space. So this guidance, again, helps facilities retrofit improvements, indoor air quality, and slow the transmission of the viruses via the HVAC system, because that is kind of the biggest thing where the virus will move around. The goal is to increase outside air, improve air filtration, control and monitor humidity, CO2, and temp. There's some science around that, is exactly kind of how this virus, moves and grows and shrinks and dies based on a lot of different environmental factors. And I think we're all pretty well aware of some of those things, how that works. This guidance should be applied to each unique climate zone, unique to the school and the HVAC system. So again, you got to almost take this and make sure that what you're being recommended is going to fit your application. And all retrofits, modifications must meet or exceed the ASHRAE 62.1 and local standards, again, for your communities, as well as the national guidelines of ASHRAE as well. And we can certainly send this out as well too after, so we can make sure you have a link to where this is, because there is a lot of good information that is involved here. But we're going to try to go through and break down a lot of it here with this discussion. So with ASHRAE's position on SARS-CoV-2 is exactly kind of where a lot of the information comes from, and exactly what we've called the virus. The infection of SARS-CoV-2 through the air has a very high probability. Again, you can see the different sizes of the particle. settling in still air, kind of how it works. And this is a representation here of some of the information we have seen. Again, this is a lot of research that's available too, but again, this is ASHRAE's position on it. So there was research around the viral droplet, which the viral droplet was greater than the relative humidity and the temperature. That was kind of some of the big things there. So factors with low to high relative humidity, high CO2, where classrooms, labs, and lecture halls and sports arenas, having too low of humidity would cause the virus to shrink. There's usually a water envelope around the virus. The virus would end up shrink and the lifespan would be longer and would also be able to fly around a little bit more, hence why the the social distancing. More humidity in the air causes the virus to grow and fall down, or land on a surface, and it could be on the surface for a certain amount of time, or it could just be living a lot longer because of where it is. So there's different ways that the particle is still moving. So step one with this, collect the data, school from the HVAC systems, and then also measuring the outdoor air, the filter differential pressure, the room relative humidity, CO2, temperature and pressure, and then also the building pressure. A lot of these factors are very important, especially outdoor air. And we'll get into this a little bit further, but having more outdoor air actually helps lower your CO2 levels. Thus, lowering CO2 levels helps with cognitive functioning. Filter differential pressure, making sure both sides are okay so you're not burning out your motors. I know there is a common misconception on having certain MERV filters based on certain variable speed motors and horsepower that these motors will come with. So making sure you have the right filter for your fan motor is very key. And then also the building pressure as well too, making sure where the positive and negative pressures are. Are we taking is the pressures moving in the different ways to make sure that we're getting it away from students and administrators and anyone else, from these rooms. So again, a lot of different things that ASHRAE put into this within the Epidemic Task Force guidance. So the research relationship between relative humidity and COVID viability. Again, relative humidity that is less than 40%. The droplets are they're airborne longer. That also creates the immune system can be compromised. So we are breathing in these particulates. Same with the flu virus as well too. If it's less humidity, that means you could breathe it in. The masks are one way to make sure you're protected against it. But again, sometimes that may not be the case, and it depends because of that little particle could get smaller and make it through certain things. But ideally, we're relatively at a 40% relative humidity, between 40 to 60% within a building and even in the outside environments as well. Again, with the smaller particles, and if you do breathe in a particle that's small, again, I'm not talking not just on COVID, but also other things as well too. Clearing lung fluid is impaired as well too because it's so small. It's hard to get that out. It's decreasing the body's ability to fight an infection with a lower humidity. So having humidity a little higher definitely helps. The particles are under about 5 nano or 5 microns. And then you also have the 5 to 2.5 microns. They travel deep inside the lungs, and that's where the greater chance of getting an infection will come about. So again, there is research around this. There's some articles here as well. I know we can definitely talk more about that, with another session as well when it comes to some of the science that we've come across and also how it's tying back towards ASHRAE. We'll go to the next slide here. So understanding kind of the problem and where this goes. Relative humidity above 60%. So this is if it's bigger. Viral droplets desiccate less, so they will, they won't shrink. The large diameter also means that it will fall faster. Larger diameter droplets, it will also stay, and it's viable longer on surfaces, several hours, several days. It really kind of depends on what is around it, what's kind of protecting that particle or the virus. And then other ways too, reason why relative humidity above 60%, this also promotes mold growth. So if we really think about it here, between 40 and 60%, of relative humidity is more of an ideal operating temperature or operating arena, simply because one, you go too high, you could get mold, and we know what mold does. If you go too low, things get dry, things can fly around a little bit better, they get smaller, and some of the filters and some of the other things that we use to try to get rid of these particles, that generally will cause that to kind of pass through. So that's where ASHRAE came about. The 40 to 60% level is because it's kind of that happy medium of, okay, what can we capture within the filters, within the HVAC system, and what can we take care of a little bit easier. So if we look at school filtration and ventilation, again, you can see all the different MERV ratings. So the ideal MERV rating where we really want to kind of be in is at that MERV 13. That's the recommendation from ASHRAE. Again, air filter and trap, different particle sizes, you're getting about 75%. That's the 0.3 to 1.0 microns. You can also, when you're at 90% or better, different sizes and whatnot. So we understand kind of the sizes of the virus, what we're going to capture the best. That's ideally where we want to be. HEPA is at a 0.3. That can be down that level, and again, it's just the 99.9 just keeps going up more. So HEPA is your best, but it's also very expensive. The envelope, again, it will be around it. The droplet's bigger than the virus, so again, that's a way to capture it with the 40 to 60% relative humidity. At this point too, it's like if you go from MERV 16 to MERV 20, you're almost splitting hairs at this point, because again, we're just adding another 1/10 to the number of what you're capturing. And then we're going to look at it here very shortly, that between MERV 13 and 14, you're going to see a giant price increase. But as far as your functionality, you're relatively staying the same. So that's another aspect, when it goes to looking at school filtration and whatnot, and what filters you want to put in. That's a big way to take a look at that. So school filtrations and ventilation, here's some information. So this was kind of a study that was done at one point, just taking the out of 4 different areas, in different areas around the US where we have probably different humidities, different temperatures, so on and so forth, different climates. But we took a look at, or not us, but the group that provided this overview, taking a look at exactly what is the actual risk of infection with these different filters on a sliding scale, also compared to price, because price is a big thing. I know there is a lot of budgets available to upgrade systems. The government's providing money, local governments are providing money to be able to upgrade systems or implement certain data logging features as well too within your schools to monitor these things to get this all kind of squared away. But looking at the school filtration and the ventilation, you can see the MERV 13 and 14 filters. That's kind of where the main point is, to where you're getting the best bang for your buck cost-wise, but also reducing the risk of an infection coming through that filter. And again, that's also proper operating conditions, temperatures, humidity, CO2, all those aspects. And then you can see at this point, if we go back, and I'll go back here very shortly, but you can see the 15, 16, all the MERVs that go up to even the HEPA, the price generally just goes up. So I'm going to jump back real quick just to kind of show everybody, again, MERV 3, 13, and 14, where you're sitting. And then these are relatively, once you get to 16, 17, you're relatively at the same as where you're at, but that price just keeps going up. So again, you want to make sure from that perspective on, where, when you're looking at filters and that, get the best filter that's going to work for you. And also, again, there's other factors that go into not just filtration, but also outdoor air coming in. The one down below, again, annual costs for HVAC filtration. There's another study that was taken as well, where we're comparing the actual filter costs and the fan power, which is the fan energy cost. Generally with adding these different filters and whatnot. And if you look, there's about 100 different facilities that we're taking a look at. It's not a big increase in the fan energy costs. If you're looking from a 13 to the 14, it's not too bad. Once you get in the 15, 16, that's where you're going to see the bigger you're going to start seeing a little bit, but then obviously HEPA, that jumps up big time there. The filter costs compared to the actual, the actual energy cost is very small. So 13, 14, the filter cost is small. You are running a little bit higher, but 13, 14 again is the ideal area where you're looking to be. And again, labor costs are pretty minimal as well. MERV 13, again, that's usually making sure that if we're going to MERV 13, you're going to have a stronger motor in there, and then obviously those labor costs don't go because you might already have those in there. But yeah, the manufacturers also, when you go to buy a unit or a BMS system, or if you're working with a consultant, obviously you want to make sure that the manufacturer's specs on those pieces of equipment, they have rated filters that will fit their fans. So if you are a contractor, I'm sure you're aware to always take a look at your specs whenever you're outfitting a building or you're doing that engineering. You always want to make sure that you're looking to see, okay, what filter rating do they recommend? And again, it's obviously good to communicate with the school because the school may want HEPA, they may want something else. But ideally, there's ratings that need to go on it, so that's something you need to keep in mind. So with some of the other things with SARS and CoV-2 and CO2, there was a lot of research around some school data. Again, this was a survey that was sent to administrators that was kind of giving these administrators an idea to kind of critique their school. How are they handling, what exactly does my school have? Like, is it Windows, BMS system, HVAC systems? Or just the old-fashioned box fans that used to be in the windows, or those giant fans that used to be by the windows as well too, that would constantly rotate air through. So this was a study that was done. 99,000 K through 12 schools are roughly about 42 years old. So older buildings. I know, for example, my elementary school and my junior high, when I was in school at those times, we didn't have air conditioning. It was hot. So, and that's in Pennsylvania when it was, near the end of summer. But we did have heat. So that was the one thing that we always had. And a lot of schools always had heat. I'm sure there's some that do not. But 30% rated their HVAC systems as fair to poor. And again, what they mean from a poor perspective, again, that is kind of where they're filling as, okay, based on the criteria, what is ideal, that's where we're going. Windows were inoperable or could seal for security. Outdoor air was inoperable or closed, so the units, if they had units, if they didn't have units, those boxes were closed. Minimal to zero outdoor air. That means nothing was coming in, or just whatever the window would be to be open, which thus increased the risk of infection. And CO2 increase also drops cognitive functionality as well too. Again, there is some studies around that. Berkeley lab has done some, and then it was also followed up by Harvard Library. A lot of these aspects, have come into play to see from a CO2 perspective. More CO2 in the air there is some link to it, reducing cognitive functionality as well too. So having fresh air in a school is very important. So, taking a look of the research link between the outdoor air with CO2 and COVID, this is another study that was done at one point. This one kind of shows exactly how the virus pieces are flowing around. So we all know from a usual room that, if we're bringing in outdoor air, we're also expelling some outdoor air or indoor air as well too. So the virus has an opportunity to make its way out. An air filter will do its job the best it can. So all this air, all these particles, whether it's COVID, whether it's the flu, whether it's any kind of particle that can cause any kind of infection, there is, adding outdoor air into it, whether it's you're expelling it as an exhaust or you're bringing it in as fresh air, and having a filter is going to greatly reduce the chance of having an infection. Reason why is you get a chance to get rid of it. You also have a chance to run it through the filter. You're also bringing in fresh new air that is better as well. So this was an article that was done, that has and how this kind of works and exactly kind of where it's going, and especially the inhalation and the exhalation of whether it's the virus or anything like that. Again, that's all moving around. Plus, it helps it grows, it shrinks, all the different pieces that will go on. but this shows you an idea, representation of exactly how everything is flowing around. So now jumping into kind of more of the ASHRAE's epidemic guidelines here. This is one piece that was very important within the epidemic task force. Again, it's the nurse's office. And I'm sure many of us have been to the nurse's office. We know usually that's where, when we get sick, that's where we head. Sometimes that's where the parents would also pick us up as well too. That would usually be in the front of the school. But the nurse's office containment requirements are very different. Because this office is going to be treated as an isolation room. So if a student was to become infected with COVID, they would have to come here, do their basic tests. Okay, determine that this student may have COVID. We might have to put them in isolation. So 1 bed per building. This is ASHRAE's 170-2019, Chapter 8. That's one part in there. But the nurse's office, has to have, and the nurse's office in the isolation room has to have between 0.05 to 0.15 negative inches of water column. Again, this is from a pressure perspective. The protective room, again, this has to have a positive pressure. So we want to make sure we're having negative and positive pressures, which are very important to this. So having that is essential, because we want to make sure that we are containing the virus and that we're not letting it go anywhere. So different tools to do this is definitely making sure that you have a tool that's going to measure that differential pressure, whether it's positive, negative, getting both sides, and so on and so forth. There needs to be 2 switch modes, and isolation and normal. So normal operation, the nurse's office would operate as normal. And the isolation would change the system to make sure that you have your positive and negatives going to the different rooms with your different supplies. So having a dedicated HVAC system for this nurse's office is very key, because that's where you can kind of mitigate, if someone has it, because we know that's where they're going to be. They could have been everywhere else in the school at that point, but if we get them in there, we at least know we can contain it and take care of it from that perspective until we get that figured out. Again, 100% supply exhaust. This is about 10 air changes an hour that this takes place. We got to understand that winter and summertime has different humidity aspects. So we want to make sure that we're keeping the humidity at a safe level, as well as the temperature. Follow ASHRAE's 170 Table 6. That gives you an idea as well there. MERV 7 with HEPA is a one way to go about it. It's obviously of that MERV. My feedback would be on the MERV 7 with HEPA. If you cannot afford anything over the MERV 7, you could go with that and then have a HEPA in there. But again, I'm sorry, let me take that back. Not affording, but your fan. If the fan can't handle it, you at least have the MERV 7 that will be within the unit, and then your HEPA is elsewhere, that you can make sure that you have it covered. MERV 14, if the current HVAC can't support it, that's go to the MERV 7 with the HEPA. But MERV 14 with a HEPA is almost double, which that would help as well. So just reviewing again the epidemic task force, kind of where that goes. The baseline HVAC, outdoor air, by measuring supply, exhaust, building pressures, filter pressures, temperature, and relative humidity controls. Every parameter of the system was initially specified. So when that system was installed, you need to make sure that you have everything, that you're following those specs. So generally on a startup, you want to make sure that your unit is running as it should, per when it started up, per the specs of when it was set. That's very important. New operations, the building sequence before school and during the pandemic. So there is operational procedures to starting a building. Again, we're going to go into that here a little bit. So like purging the school 2 hours before and after class. So you want to purge the air by dumping in 100% fresh air and taking out the air that's there, just to have it clean and clear with everything, as well as you're also doing your disinfecting and sanitizing as well too, what you would typically be doing. But from an air perspective, like I said, you would sanitize chairs and doors and tables. You also want to sanitize your air as well too, because the air does still contain some of the virus that could be in there. So clearing that out and taking care of it, that's important. You want to control the CO2 maximum, again, 800 parts per million. That's generally the level you want to kind of be under or at. You don't really want to go over, but there are some local regulations, specifically California has a requirement where they don't want you to go over 1100 ppms. Control the outdoor air minimum to 10 CFMs per person in classrooms, labs, halls, any kind of not, I'd say low gathering in a sense, because classes are low, labs are low, and some of the halls, especially in dormitories, are lower. And then you also on the sports arenas, gyms, bigger gatherings like a cafeteria, you're looking at outdoor air minimum of 20 CFMs per person. So that's another aspect you want to make sure as well too, is that whatever we have in there, we want to make sure that we're calculating this and that our outdoor airs are going to be effective to what is coming into the building. Controlling the relative humidity and temperature, 72 degrees, 40 to 50% in the winter, 75 degrees and at 50 to 60% of the summer. That is ideal for keeping those controls. Increase filtration to MERV 13 or better. That's what ASHRAE is recommending to use. And again, from a cost perspective, you can certainly do that. You can go up as well too if you have the budgets for it as well. Install relative humidity, CO2, and temperature monitoring sensors. These are very important, whether your BMS system has it, a BMS system you're looking into, or even just data loggers as well too. You may not even need to do a BMS system because you have an air conditioning system that does meet specs, that does work, but you may be missing some of these different sensors as well, which you can put these, within your room. You can put them in different areas. And you can be monitoring this as well too. So you have that ability of those options. Monitoring the nurses isolation room, control monitoring, you got to make sure that's important. That's also in this epidemic task force with schools. Data log and report relative humidity, CO2, temperature, and pressure to district committees. ASHRAE does recommend that you set up a committee within your school district to make sure that you are monitoring, whether it's with administrators, teachers, parents, anyone that would be involved in this. Is you have a committee that will take a look at that can help make decisions based on what is there. And then obviously you want to review that data as well too. And again, this is all from the Epidemic Task Force on Schools and Universities for this whole group. Some of the things that they are giving you to make sure you're keeping track of. So looking at some of the best practices here, this part is pretty important simply because we want to make sure that we are measuring the initial HVAC performance of the school. And the reason why you want to do this is because this is, ensuring that your school is up to par with the different standards. Has my system kind of tailed off because it could be old, it could be new. I mean, there's all sorts of different ways you want to go about this. So what are some of the best practices to measuring it? And again, with Testo, I know part of the webinar here today is with, measuring with Testo and validating these things, because we do have many tools, many instruments that will measure this indoor air quality, that will help you with balancing pressures, relative humidity, temperature, CO2. But ASHRAE's monitoring and data logging is the correct action to go. That is one way to do it. What is the benefit of data logging? Well, having a data logger in your room can see the trends of when students come in to when they leave. You can see the fresh air coming in when your system kicks on. That is one way of being able to see the trends. You can also take those trends, give them to a consultant, a building consultant that can take a look at your air and say, hey, we might need to upgrade your HVAC system. You may need a BMS system. But the nice thing is we can monitor the hot spots of what happens with data logging. That's one thing that, with Testo, we do have that ability with our 160 IAQ, which we'll hit here very shortly, especially in the schools. Room relative humidity, CO2, and temperature sensors need to be more accurate, robust, and calibrated to confirm this data. Again, that's very important. Whenever you're going to look at data loggers or any kind of sensors, you always want to look at their accuracy. You always want to look at their technical data and their technical specs. One thing that we preach a lot here with Testo, especially our sensor technology, is our accuracy. We always are asking the question, what is your application? How are you using the instrument? What are you trying to get out of this? What are your different thresholds and what kind of accuracy you're looking for? Those are very important because, you could get something that may not be as accurate, and it's cheaper because it's going to get you by. But you could be out of the different, how can I say it, out of the different thresholds that ASHRAE recommends, or AHRI, or any other group, or like NEB that also has different aspects of what these need to be. But today's school HVAC systems are moving towards hospital type HVAC systems. Again, we've got lots of kids. We understand that kids do get sick, same with adults. So in a sense, these HVAC systems are almost acting like hospital systems. Lots of people in one area, someone could get sick, it could infect others, germs and things like that. So having these HVAC systems very similar to hospitals will allow that to be a safer environment. So the technology is getting better. Things are getting, manufacturers are listening and they're working to make sure that you have different applications for what you can use for these new HVAC systems. Next level sensors are calibrated and accurate and independent monitoring for this health and safety application. Sensors are becoming better. They're becoming very precise. There's a lot of different things that will come out of this. Testo's 400, 440, 420, and various probes we have. Those are our indoor air quality ones that can be used to actually measure initial HVAC performance in schools, whether it's balancing, whether it's indoor air quality, whether it's making sure that the venting is balanced as well, or even just having probes run throughout a day on a data logger on a stand within a room to make sure everything's okay from a turbulence perspective or airflow or even CO2. You have that. Accurate, reliable, and calibrated data is what Testo has. Verifying schools' initial HVAC performance. We're able to do that as well too by having standards. We also do have different ASHRAE measuring protocols in there in a lot of our devices. And emailing these reports are available as well too, that can come out of our devices. So we jump into the next slide here. So long-term data collection with CO2 relative mean temperature. If we're looking at the big picture here, the BMS systems can handle data. They're designed to handle data. Siemens, Johnson Controls, Honeywell, etc. more. But the biggest question is, if you're looking at the big picture, can the customer handle the price? To be honest with you, these are expensive systems, and they also do come out of price. They also do take a while to install, and finding contractors to even come in to map these things is becoming increasingly hard as well too, because money is available through the government. The reality is, again, the high install costs. There's a big timeline to it. You got to get permits. You got to get, whether it's union contractors or private contractors. You have construction that's going to happen. Consultants being available. Again, that's a hard thing right now, is trying to find somebody that can actually come out and map your school and do those things. It's not a very cost-effective solution because it's so big. It takes time. There is a lot of upside to it, but it could take you a while to get one. Most schools do not have a BMS system. That's understandable, because I think we looked at the data before. A lot of schools are about 42 years old. The newer ones are having it now. That's kind of where that is going. Room sensors of CO2, temperature, and relative humidity do not have the accuracy, range, and stability that, say, a data logger would have, or a company that specifies in that specific realm. So those BMS systems are not as accurate. I can tell you that we do get some that we get calls, especially I get calls on, I have a BMS system, but I want to make sure that my accuracy, I want to make sure that my BMS system, I can make sure I can validate it against some instruments. What can you do for me? So we do have a lot of 400s and 440s that are being sold to help make sure that, or validating your BMS system is up to par and up to where it needs to be. Because maybe the sensor could be bad. The sensor may be out of calibration. You may have to swap a sensor. It could be broken. There's a lot of different aspects that you want to make sure, especially if you're very concerned about your indoor air quality. There is no internal data memory. There's no NIST certification. And these are wired solutions as well too. So you're running a lot of wires, not Wi-Fi. So it's almost like a 90s technology in a sense. But systems are being built for the new age. But again, with the new age, a lot of new things are coming out as well. So we'll go to the next slide here. So just taking a look real quick, I want to kind of go through some of the products, because I know we did talk about a lot of the standards, and especially with ASHRAE where things are at. And this webinar is being able to validate spaces using Testo Instruments. So one of the big ones that we do have is our 160 IAQ Wi-Fi data logger. This one can measure temperature, relative humidity, CO2, as well as pressure. This is all just a logger that does not require any kind of hard wiring, does not require any base station. It simply connects to your Wi-Fi. If it's secure, we can definitely work with that. There's protocols to go around that. And it connects, and it can be available on any online browser, which is our Severus 2 cloud. Again, a very quickly deployable solution that gives you visual alarms saying that your ppm is too high. Open a window. Relative humidity is at a certain level. We have to maybe turn on the ventilation and whatnot. There is ways you can do it. Plus, these data loggers, I think I made the point earlier, these data loggers also can be hotspot mappers as well too for different rooms. If you stick one of these in different rooms, you can group them into certain areas. You have different places where you can go. You have the ability to make sure that you can map out a room for when it's full to when it's not, and you can see the trends on how everything's going. But again, we can also give a demonstration on that as well too, or one of our other webinars that we've had as well with the 160 IAQ we've talked about. Again, we have a whole lineup of 160s that go with temperature and relative humidity. There's ones that you can connect probes in that do light as well. And we also have ones that, basically can conform to ASHRAE's new guidelines. Whether it's, we have everything covered from that perspective. This is continuous data logging. These can last up to a year on battery, or you can even just plug them into the wall as well too, and they will run constantly and have the battery backup. There's lighting, there's airflow, there's all different pieces that go about this. This is all Wi-Fi. There is no additional cost to it besides if you want to pay for an advanced license per the logger. You certainly may do that. It's about, I'd say, like $1 per logger. We do have NIST calibration, so we assure the accuracy that we can do this once a year to make sure you are complying. And then also you can do reporting with it. You can have set alarm limits. You can also set alarms via text or email as well too, so somebody knows, okay, we hit a limit, we need to do something about it. So I kind of wanted to take the time here to look at the competition in a sense of what is out there, because I think it is kind of important to know here. And I want to kind of make some of the points as well that, this is where you really want to make sure of, hey, what exactly are we looking at from a perspective when we're going to look at different things. So again, there's different, the ppm values where you have, there's different levels to where they measure from. Your accuracy, kind of where you're looking at, plus or minus, some don't list it, some do. I will say there probably is some that could be better than Testo, and there's some that may not be. Relative humidity, does it have relative humidity or not? All these different pieces. So you always want to make sure you're doing your homework before you go and buy any kind of solution to make sure that, hey, is it going to meet any kind of regulatory requirements? Two, is it going to meet any local requirements I have? If there are no requirements, are there any mandates? Because there is difference between mandates and requirements. Requirements obviously required, mandates are recommended. But you always want to make sure that, and you also want to take a look at, are there hidden fees? Am I going to have to pay anything additional outside of this logger to have contractors come in and so on and so forth? Those are all different things that you want to make sure that you are taking a look at when it comes to the competition, because everyone is different. Everyone has their offering. Their price points are very different, as you can see. But then again, you also got to take into account the additional costs on top of that as well. So, again, looking at the competition, just kind of summing this up here. So first, the cost does not tell the real story. Again, for example, I'll look at the Honeywell here, the CS C7262A. That one's $263. That one looks like the most attractive one here, but I think if we went back to it, it doesn't have relative humidity involved in it. It's going to require wiring to power it. It's going to require some sort of Ethernet wiring. So if I'm thinking about all the costs that go involved with that, I'm thinking about, okay, contractor costs, permitting costs, shutting my school down or my building down. I got to pull these wires. That cost starts to add up. And with the Testo one, we don't have additional costs. We just have the logger and we have just the online cloud. The only cost I could see adding is if you want to put it in a specific spot to have a cord, you might have to buy an extension cord, could be really it, or put an outlet in. But generally, you always want to make sure you're asking the questions on cost. What more am I going to need to pay outside of this? And that's also very important. Typical small school, 20 classrooms, 3 points, relative humidity, CO2, and temperature, continuous monitored. That's about 60 points or so of what you need. That's important. And again, having a online system that can collect that data, group that data, do whatever you need with it is very important as well too. So you always want to consider what am I going to get for what I'm going to spend as far as a data output as well. What would be the cost to engineer, schedule, installation labor, configure, program, start, and commission? Again, that cost gets pretty expensive. And I think what we've done here is we've put kind of an idea of based on what a typical classroom would be, give or take the pricing here per point, at 60 points, we're looking at 90 to 100,000, excluding the equipment costs, just to do the engineering, the labor, the configure, and any of the kind of work that's going on there. And then just to give you an idea from a Testo perspective, $3,000 for say 1 hour unit, $150 an hour, 20 units, for an install perspective, that's kind of where we're at. And then about 16,000 for 20 units, you're covered there from your 160 cost. So cost wise, makes sense. But again, it all depends on what you're trying to monitor, where you're at, and kind of where you want to go with any kind of logger. And again, the most important thing is you got to do your homework. You got to make sure that you have everything covered, because you want to make sure that your students are safe, your administrators are safe. Anyone that comes into that school, you want to make sure they're safe. So having reliable solutions, ensuring that we're following guidelines from industry experts, or industry expert guidance groups such as ASHRAE, AHRI, or NEB. All those different groups that are involved within this are all working together to make sure that we can provide as much information as possible. Manufacturers will adhere to that, as well as equipment manufacturers and tool manufacturers. We all are working together to make sure that we can provide a safe environment for students and teachers and everyone else that's involved in these buildings. So I think with that, that concludes kind of where we're at. So Julie, I will turn it back to you and see if we have any questions.
Okay, wonderful. Thank you so much, Aaron. That was a really great and thorough overview. We do have some time for our audience Q&A now. So if anyone does have a question, please go ahead and feel free to submit it into the panel on GoToWebinar, and we'll do our best to answer that question for you. We do have a couple of questions already received here. So Aaron, the first one we have is that the chart says that MERV 13 traps up to 75%. What about the other 25%? Will some still go through?
Yes, that's actually a really good question, and we get asked that a lot. There is really, and again, it all depends on the virus, and it depends on the size of the particle or whatever is going through. So there will be some, well, actually I say the answer is yes, you will get some go through. I don't know if anyone has heard of, there's UV lighting, there's different UV lamps that are also being implemented as well too, to kind of help with the particles a little bit. But any filter you use is going to have a little bit. Now, again, it's how much you spend money for. So there will be some that will go through. And again, that's where the outdoor air comes into play, is making sure you have some outdoor air so that you can try to reduce some of that does even go into the filter to help kind of mitigate that. But yes, you will get some. It's going to happen. It also depends where you want to put your UV lights as well too, wherever they're recommended, to give yourself a little extra that added support.
Okay, great. Thank you, Aaron. The next question that we have here is, why can't a building automation system control all of these factors related to airflow?
Okay, that's another great question as well too. So building automation systems comes in all different sizes, shapes, and flavors. they are not going to be able to control everything because again, it depends on how the sensors, how the building could be wired, how exactly we're getting that information at all times. Building automation system or the building management system is only going to be able to really kind of control when things come on because of different levels that it hits, shut off different areas for, if I have a certain zone that's filled with people and one zone that's not, open the outdoor air, indoor air, or also, based on, okay, if I get this with sensors that if my levels are certain ways, I can close this and that off. So a system can have it. It also depends on how much money you're willing to spend as well too. But also the technology, is still in a sense kind of behind a little bit. But manufacturers are working super hard to get up to that. So they eventually will come around from an airflow perspective that we can take advantage to just having loggers in there and being able to control different aspects.
Okay, great. Thank you so much, Aaron. And we are running up close to time for today. So thank you to everyone for joining us, and we will make sure that we have Aaron respond to the rest of the questions that we've received via email. So on behalf of Testo, I want to thank everybody that attended our session today, and thanks to Aaron as well for a great presentation on validating and controlling IAQ in educational facilities during a health crisis. Thanks so much, everybody, and have a great rest of your day.
Great. Thank you, everyone.